going to be talking about pregnancy after bariatric surgery. We have had many OCC babies. We love OCC babies. So we want to make sure that our babies are pretty healthy. And let's just discuss a little bit about the relationship between pregnancies and the bariatric surgery. Moms get healthier, and therefore they even change the gene expression for their babies. So that's amazing, because healthier moms make healthier babies. So the bariatric surgery is a great resource to improve not only your health, but the health of the future generation. So that's good news. Now, as with all pregnancies, there are certain risks associated to malnutrition. Let's talk about malnutrition. Of course, the bariatric surgery can further worsen malnutrition. And if you add the pregnancy on top of that, it can become a problem. It can become an issue. Most of the societies for endocrinology or obesity or even bariatric surgery recommend waiting at least 12 to 18 months to conceive a baby. And OB-GYN societies recommend to wait a little bit longer, about 24 months. And that is because first, we need to make sure that the weight stabilizes, and second, we need to further improve nutritional status. Obesity is a state of malnutrition, and it's also a disease of hormonal imbalance. So it takes that long to balance your hormones and to stabilize your weight. After that, conceiving the baby shouldn't be a problem as long as you do make sure that you're having enough nutrients. So the main nutrient that, as a bariatric patient, that you need to meet, and especially once you're pregnant, is protein. Protein is the building block of your hormones, of your blood, of your tissues, of course, your skin and your hair, but it's also the building block of the baby. So you're making the baby mainly with protein. So that's something that shouldn't be missed, and it needs to be built up to about 100 grams of protein per day. So we all know that each patient has a very specific goal of protein to meet, but in pregnancy, we need to make sure that we get it to 100 grams. Since you have a very small stomach, then of course it's very difficult to meet that through food alone. So you should be including a protein shake, and that protein shake has to be of very high quality, because then again, you're building your baby with it, and you shouldn't be including chemicals to that. A recent study showed that 287 chemicals were found in the umbilical cord of a newborn, and some of those were associated to cancer. So we need to reduce the toxic load while being pregnant, and that means that your protein should be of very high quality if it comes from food or if it comes from a protein shake. Now, in addition to the protein, you do need to make sure that you're getting vitamins and minerals that have been very well known as an insufficiency during pregnancy, and one of those is iron. So you need to be including red meat, and you need to be including foods that are rich in iron, and you may supplement with additional iron during pregnancy, but we recommend to just use the multivitamin that we have always recommended, the one from My Progress MD, which has 18 milligrams of iron. And check your serum iron. So if you do have a deficiency, then only then you can include another supplement, but that should be enough, and that will cover you. Folic acid is another nutrient that matters. It matters to how the nervous system of the baby is being made up. So you need to make sure that you're including a lot of greens. And of course, that is also found in the multivitamin. Another vitamin that has been deficient in 70% of the cases of pregnancy after bariatric surgery is vitamin D. You need to check your serum vitamin D, and after that, we will need to know, that's the only way for us to know how much vitamin D you will need to supplement with. So that needs to be very specific. Omega-3s are important not only because worldwide there is a great insufficiency of omega-3s, but it's also how your baby is going to be building his or her own cells. So that's just amazing. You're also building your baby on that. But fish might not be enough, and some fish are contaminated with mercury. So stick to 2 up to 3 servings of fish sources in a week, and supplement with omega-3s that have been tested for heavy metals, that have been tested for mercury, for dioxins, and for pesticides. If the omega-3 it doesn't have that type of testing, do not include it. And that omega-3 should be mainly DHA. That's for your baby's brain, so that's cool. And other minerals that might be lacking are zinc and calcium. So you are pretty much covered with the multivitamin and with the calcium that we recommend. Of course, those should also come from food, and you may find calcium in dairy products and in dark green leafy vegetables. And you get the acid folic as well out of that, right? And zinc is found especially in seafood, which you would need to limit if you are pregnant. So the multivitamin will cover that part, and including nuts and seeds, especially like sunflower seeds, those are rich in zinc, and that should also be enough. So yes, your nutrition matters when you're pregnant, and it matters more after bariatric surgery. We do have an article for you that will take you through all the studies that have been talking about what I just said, so you can have a little bit more of information. And I hope you find that very helpful. As with any pregnancy, it's all about what you're eating, okay? So let's work on that. All right, so there's just 2 more things that I need to let you know, okay? Since bariatric surgery increases fertility, if you have a history of infertility, you may not be using methods to prevent pregnancy, and you might surprise yourself. So it's important for you to use methods to prevent a pregnancy for at least 18 months, okay? And the second thing that I wanted to say is that vitamin A is also very important while you're pregnant. And my concern is that if you're taking commercial multivitamins, the vitamin A form that is found in those multivitamins is retinol, and retinol changes the gene expression of the baby. So that could be a problem, especially if you are a smoker. So you need to make sure that your vitamin A that is found in the multivitamin is beta carotene. It's not retinol, okay? And that's good enough. That's all. I've covered everything now.